Hi, my name is Elizabeth and I'm going to demonstrate doing a central line dressing change today. The first thing you want to do is just ensure that you have the correct patient. The head of the bed is elevated if you're having an IJ site, and the bed is elevated to an appropriate level for you to do the dressing change. I also want to make sure my bedside table or whatever surface you're going to be using is above my hip level. Before I start, I'm going to sanitize my table with hospital grade sanitation wipes and allow it appropriate time to dry. I'm also going to need my central line dressing kit, so I can be getting that in the time that I'm waiting for my wipes to dry. In the kit, you'll have your sterile dressing, as well as sterile gloves, alcohol swab, and then a mask. I'm gonna put some clean gloves on. And going to place a mask on my patient and turn his head away from the insertion site, as well as putting a mask on myself. For the purpose of this video, I'm just going to leave the mask off. Next, I'm going to be removing my dressing. So you want to do this with clean gloves. Okay, and then I want to make sure that I'm removing the dressing towards the insertion site, not away, and we want to just follow where it's inserted. Okay. My next step, I'm going to sanitize with hand sanitizer. And I'm going to open my sterile gloves. I'm gonna pull the bottom out this way and then open them wide. Now I'm going to prepare my packaging, and you always want to open away from you, and then lastly towards you. I'm going to place my gloves on. Okay, now I'm going to organize my tray. I have my CHG, skin barrier, and I also have alcohol swabs and my dressing. So first I'm going to open up this packaging for the CHG. I'm going to take my gauze, hold the catheter, and I'm going to scrub back and forth using a gentle friction at the insertion site for about 30 seconds. And you want to make sure that when you're scrubbing, you want to start inside the area closest to the insertion site, and then as you are moving out, you're not going back into the insertion area, because we don't want to be bringing bacteria back to the insertion site. Okay. After the 30 seconds has passed, we're going to let the dressing dry. Once the CHG is dry, I'm going to grab my skin barrier. I'm going to place it around the dressing just so that it stays in place. Next, going to take my CHG dressing and peel back the backing. And I'm going to make sure the CHG square is covering the center of the insertion site. Once that's covered, I'm going to peel off these pieces. I'm not going to throw them away because we're going to need them later. I'm going to take what we call the pants. I'm going to place it underneath the lines to secure the dressing in place. And then I'm going to take this piece. This is just meant for dating and initialing. And I like to put that over the lines to secure it further. I'm going to take my pen and I'm gonna put the date as well as my initial.